Okay, good morning, Union family. Y'all can do better than that. Good morning, Union family.
Good morning.
I'm Margaret Cook, the Vice President of CWA's Public Healthcare and Education Worker Sector. I'm so excited to be here this morning with so many leaders in the CWA family and discuss an issue that is so critical to many of us, the ongoing attacks on healthcare. When the so-called One Big, Ugly, Beautiful bill was enacted, it made big changes to our healthcare system that had serious impact on unions and working families. The law not only stripped $1 trillion from healthcare by gutting Medicaid and the Affordable Care Act subsidies, it was a massive transfer of wealth from the working class to the billionaire class. An estimated 15 million Americans will lose their coverage over the next decade, all because the Trump administration and the congressional Republicans wanted to push tax cuts for the wealthy and corporate executives. Now, you all might think that because we're union members and most of us have employer-sponsored health care, we're safe. But these cuts will shift directly onto us, hurting our members on the job, our wallets, and our local communities. To dive into the details of these attacks and how we fight back, I am joined by an outstanding group of panelists.
Thank you.
We have Congressman Stephen Horsford from Nevada's 4th District, the co-chair. He is the co-chair of the Congressional Labor Caucus. We have Tom Leibfried, a legislative representative for the AFL-CIO, and a proud member of the Washington-Baltimore News Guild Local 32035.
15 years.
We have Tori Henley, a member of CWA Local 1122 and a home care nurse out of New York. And we have Kyle Rable, a member of the Texas State Employees Union, CWA 6186, and a Democrat running for Texas's 19th Congressional District. Thank you all for being here. Let's jump right into it and talk about what happened with the big old ugly bill. Representative Horsford, you were right in the thick of it as the bill went through Congress and heard all of the promises that this bill would benefit the working class. But we know that the billionaires and the corporate executives benefited largely from this bill. Can you tell us how exactly it impacted workers' access to health care and expenses?
Well, first, good morning. It's great to be with all of you. Thank you to your president, Claude Cummings, for his tremendous leadership and your friendship and the partnership that we have. Prior to this congressional session, I served as the chair of the Congressional Black Caucus and now as the co-chair of the Labor Caucus. I believe in fighting for the people who make America work. And that is all of you. That is the union people that we are fighting for. And part of why we created the Labor Caucus was that we wanted to make sure that unions and the members that represent those unions have a voice on every issue that goes through Congress. That's our promise and our commitment, is to make sure that happens. Now, I call this a betrayal of a bill that was passed. Republicans that control the House and the Senate passed the largest tax cut for the wealthiest individuals and big corporations that are permanent, costing our country over $4 trillion that was not paid for, and it was on the backs of working people. By cutting $1 trillion out of our healthcare system, the largest cut to healthcare ever. By refusing to extend the premium tax credits, which allow working people to have access to health care through the marketplace, and taking away funding for the most vulnerable people on Medicaid, and all on top of that, cutting $300 billion from the Nutrition Assistance Program for needy children and families. So giving permanent tax breaks for the wealthy and the big corporations while taking health care and food away from those who need it the most. Now, you could talk about this in the billions and trillions, or you can talk about it in the real life terms that affects all of us. I'm a congressman, but I'm also a son of a mother who recently had a stroke. And now, after her rehab and all the services that she's had to endure, we decided as a family that we wanted her to recover at home. So I'm part of the sandwich generation, where I'm raising 3 college-age kids and making sure that they are off to a good start, while at the same time making sure my mother has the dignity that she deserves after raising me and my siblings. And I want to thank our home care workers, our healthcare workers, because you all provide a vital service to families, and it's truly an unsung, you're an unsung hero to me and to countless others, and that's worth fighting for.
Thank you. Thank you, Congressman. Tom, many people believe that cutting Medicaid will only hurt those in poverty and believe that good union insurance protects them from bills like this. But what practical impacts can these cuts have on costs and access to care, and even for those with strong collectively bargained plans?
Yeah, so the AFL-CIO hired insurance experts to look at the cost impact on negotiated benefits. I've been a CWA member for 15 years. I've always had negotiating at the table to secure good benefits for me and my family, as do many CWA members and union members generally. Unfortunately, what the actuaries, the health insurance experts found was that healthcare costs per person for people with job-based care, so union negotiated healthcare or just people who get their insurance through an employer, all of these folks will face new annual costs of up to $485 a year. So family of 4, $2,000. Why does that happen? The big ugly bill leaves 15 million people uninsured. So this will hit hospitals, this will hit outpatient providers. They lose all of these paying customers, and they will pass those costs along through higher prices to people with insurance. So this is not just, the folks who are losing Medicaid coverage, not just the people who are facing higher costs in ACA and finding that unaffordable. That is awful and horrible, but it actually impacts everyone.
Thank you so much, Tom. Tori, member of CWA and the PHEW sector. I'd love to hear your story about what it's really like for people doing the work. Yeah. Can you describe a typical day on your shift? If lawmakers had to spend just 1 hour in your shoes, what would they learn about how this law affects your job?
So a typical day for us is to see, let's say, 6 to 7 patients in an 8-hour time period. My actual role is to keep the people that we take care of out of the hospital so the system doesn't totally collapse. Now, when you don't have resources and these things are cut, you're gonna tell me that I can safely take care of 6 to 7 people and get everything they need in that day. So you're getting denied medications. So people like Mr. Horsford over here, his mother, who just had a stroke, can't get blood thinners because that's too expensive to cut. But what happens is you go back to the hospital, which is already strained, already has low resources and low staffing. So where I work in my area, I have 51 patients with me and my partner. And those 51 patients are your family, friends, neighbors, coworkers, and you can't honestly look at me, and I can't be dishonest with you, that I can safely take care of and manage 51 people without the support. Mm-hmm. It's not possible.
Yeah. Now, Kyle, in small towns, the local hospital, like the local university, is often the biggest employer and often the only place where people can get care. Tell us about what your community was experiencing before this bill passed, and did the bill make things worse?
Good morning, brothers and sisters. It's important to note that the man that pushed this through, Jody Arrington, is the man whose office I'm going to redecorate come November. But to put it lightly, in rural Texas and much of rural America, These hospitals are the biggest employers, and with the cuts to Medicaid and Medicare, what is already a healthcare desert will get worse. For example, in my district, there are 33 counties and 21 of them do not have OBGYNs. Women will drive 2 hours to be seen. In Lubbock, they will not take you if you are not pregnant because they do not have time or space for you. This cut directly makes that problem even worse. Within the last 10 years before this bill, underrepresented Barrington's beautiful telehealth plans, by the way, we have lost 2 more OBGYNs, and hospitals are struggling because what funds rural hospitals? Medicare, Medicaid, and CHIP. Over 30% of my district uses that, another 16% is uninsured. So essentially half of my district needs these programs, and our representative decided to cut them, and they're choosing a corporate lobbyist, his fraternity brother, as his replacement in their run against me. What I'm trying to tell you is that this bill directly impacts the CWA members in my district, my friends that I talk to all the time, because this will raise costs. This will increase costs, and it will close down hospitals for those that are working on the lines out in rural areas, to those working in health institutions as CWA members who might lose their jobs, all because we decided that we hate children and poor people so very much in this country.
Oh, boo. Thank you so much, Kyle. You've all laid out the challenges, and while it may seem like an uphill battle, unions are built to fight. And when we fight,
We win.
we need to get real about solutions and where we go from here. Let's start with Tori. With funding cuts, increased paperwork, and short staffing, working conditions are challenging. What motivates you to stay in your role, and what gives you hope for change? If workers, not politicians or CEOs, controlled the healthcare system, what would it look like?
Patient-centered care, actual health care, that's what it would look like, right?
Yes.
So I don't know if it's necessarily the word motivation, but it's this. It's us in this room, right? So as a collective, we hold the power. We just have to act like it. We need to fight. We need to take care of our neighborhoods, our communities, and our families. Because at the end of the day, humanity is not a luxury. Everybody deserves good health care.
Kyle, what is the single most important thing union members should know about protecting healthcare in rural America? And how would you suggest we advocate effectively?
You have brothers and sisters that work in rural America. We have brothers and sisters working in West Texas. I know them personally and I go to their meetings. I'm one of them, technically speaking, even though I live in Lubbock. The most important thing to understand is that though we need to action on this so quickly and so fast, you need to support candidates and people already in Congress fighting against these issues and these cuts, because we will only see increases in our benefits as union members.
Yes.
We will only see it get worse if we don't stop it in this cycle right now. We can stop it. We have to do it now. It's important that we realize that, specifically in the state of Texas, we're $20, $30 or more expensive for our healthcare costs than the national average, because we have an amazing governor who decides that, again, men, women, and children that make less than him don't deserve to live. But we're fighting against that in Texas. We have an amazing class of labor candidates across the state in Texas, and we're fighting to turn Texas blue, and we need your guys' help to do that, because rural America needs you guys to help us stand up and fight against this.
Yes.
We seem to be running a little ahead of schedule, so you have a couple more minutes to answer these two questions. Tom and Representative Horsford. Tom, in my role, I support all of our members who work in healthcare and in the public sector as a whole. Can you talk about what impact these cuts to Medicaid will have on state budgets and on public employees as a whole, and how we should be fighting back?
Yeah, I mean, these cuts from the big ugly bill will have a devastating effect on state budgets, on public sector workers, on healthcare workers generally. And states face a double whammy. They're dealing with a double whammy right now. Hospitals are closing now. Maternity wards are closing now. States are raising taxes now. States are scrambling to make up for lost Medicaid money by cutting important medications like anti-obesity drugs, GLP-1s, in 5 states because it's optional for states to do that. So they are making terrible decisions now as these cuts start to roll through. George Washington University took a look at the impact on states when all of the cuts go into effect. And just looking at 1 year, they found that the state economic activity, the GDP of states generally, would fall in 1 year by $125 billion. As a result, people aren't paying taxes when there isn't economic activity. So state revenues will fall by $9 billion. So the federal government stops sending, over 10 years, $911 billion to the states in Medicaid. That money funds a lot of economic activity, doing good things, providing health care. Healthcare providers close. 600,000 healthcare workers will lose their jobs because these services are closing down. That has an impact on who pays taxes and what comes into state budgets. So healthcare is hit. Access is hit. People have to travel an hour to an emergency room. And then other public workers are also hit because as states take this wallop to their budget, they've got to look at other areas where they spend a lot of money: education, transportation, all of the public services that states and counties provide. They will be under pressure because healthcare is taking a hit.
Yes.
Yeah. Thank you for that. Representatives. Representative Horsford, after listening to this discussion, if you're in the majority next year, which I believe, when you're in the majority next year, when Representative Horsford is in the majority next year, what are your plans to address some of the problems we've been discussing? And can you tell us about your bill to help lower prescription drug costs for people like most of our members who are on employer-sponsored plans?
Well, I said when, not if, because the people have the power. Yes. And when we use that collective power and when we turn out, we do win.
Yes, we do. Yes.
And this is no time for agonizing. This is time to organize, to make sure that we turn out every single vote. The fact that they have gutted portions of the Voting Rights Act, that they are attacking our political and economic power, particularly black economic power, it's time for us to show them it is too big to rig, and that means we're going to turn out in historic ways all across this country. And the CWA, you all are instrumental in that fight, as is the entire labor movement. When we're in the majority, when Hakeem Jeffries becomes the Speaker of the House, the first black man ever in the history of our country, when Democrats have the gavels, we will put the people who make America work at the front of that agenda. And labor, we have to listen to you. You need to be telling us what the priorities are in that agenda. We have to come with the same urgency on day 1 and day 100 that this administration and the capitulating Republicans have brought to take away our freedoms and rights. We're going to give it right back, but it's going to be for the people. One of those priorities is helping you keep more of your hard-earned money in your pocket. Prescription drug prices are too damn high, as is housing, as is groceries, and we have to provide relief. My bill, which is the capping out-of-pocket cost on prescription drugs, would apply to everyone. We passed it before, but it was only limited to Medicare. It caps it at $2,000 a year. That means If you have a serious issue and you need medicine and it costs more than $2,000, you're not going to get charged more than that. That is the law right now for Medicare. My bill will make it the law of the land for everyone. That's worth fighting for, and that's one of the priorities that we'll advance. When we're in the majority, because when we vote,
We win.
when we vote,
We win.
when we vote,
We win.
let's get out there and show people how we win.
That's right.
Thank you so much. Well, thank all of you for those really interesting and thoughtful remarks. It is clear that if workers ran the system, patient care and worker dignity would come first, not profits. There are a lot of powerful interests who are working to divide us, but if we unify and mobilize, we can win and fight back to save our deserved health care. I want to thank Representative Horsford, Tom, Tori, and Kyle for their time and insights. So y'all, let's take back what we discussed today, back to our locals, and keep fighting back. Thank you.